Hi, I'm Nancy Nacito-Freschi, and today I'll be showing you a great movement to help you to increase function and mobility in your hip joint. Okay, so it's going to start out in a pose called legs up the wall, and it's just like it sounds. I'm going to show you a simple way to get into it. So you're going to sit with your knees bent, and you're going to sit right next to the wall. Okay, so my hip is right next to the wall. My hands are on the floor. So as I start to lay down, I am also going to be swinging my legs up. And please note that your butt does not have to be close to the wall. And the first thing I'd like you to notice when you get in the pose is, how do you feel? Does it feel as though your pelvis is lifted up off the floor? And I'm exaggerating here. And if so, you're going to scoot yourself away from the wall. If you have too much strain in either the back of your thighs, your hamstrings, or the back of the calves, you're also going to scoot away from the wall. If you're feeling anything behind your knees, you're also going to scoot away from the wall. And if that does not alleviate these symptoms, then you're just not going to do the pose today. Okay? So just connect with your breath. You can let your hands rest on your belly. And just feel the rise and fall of the breath. Now what I would like you to do is I'd like you to take your right foot and you're going to lift it up and cross it over the left. Okay? And check in, make sure everything feels okay. And if this feels good, you're going to allow the right foot and ankle to slide toward the left knee. You're not going to use your hands to do this, and you're only going to move as far as it is easy to do this. So I pretty much just let my foot slide down toward the knee. You will not rest on the knee, okay, that's not safe. If your foot will easily cross the knee and go to the thigh side, that's fine. But some of you may only get this far. And please know that that's perfectly fine if this is all you can do, okay? So I'm just going to let my foot slide where it wants to, and it wants to rest and stop right there. And again, I'm feeling my breath, and I'm noticing for sensations in my body. You may feel a stretch on the outside of your right hip. It should be a gentle stretch. If it feels severe, please come out of the pose. And I'm just going to imagine that I can breathe into that hip. Good. Now, so the next thing I'm going to do is I'm going to bring my awareness to my hip joint. And moving from that place, I'm going to take a small movement with my thigh toward the wall behind me. And then I'm going to release. And move my thigh towards the wall and let it release. This is a very, very small movement. And I'm letting the movement happen at my hip joint. I'm not using my knee to push my thigh towards the wall. Now, this may not work for some of you, and be okay with that. And notice if anything else other than your thigh is moving. Do you have tension in your jaw? Are you holding your breath? Are you using your back? Are you squeezing your butt? It could be anything. Just notice if anything else feels like it's trying to help you. Or does anything else feel tight? And then let this be your last one. And then just pause. take a breath or two. And then slide your foot back up, uncross, and then just notice. Notice what your body feels like. Notice what the right hip feels like, the right leg. You may even want to compare it to the left. Now I'm going to go over to the other side. So I'm just lifting my foot up. I'm noticing to see if I have pain anywhere, if my back feels tense, if my knee feels tight. And if everything feels okay, I'm just going to let the foot slide down. Very, very easy. And again, this may be as far as you can go. You may notice that one leg does something totally different than the other. Please be okay with that. And now breathe into the outer left hip area. This may be as far as you go, or you can, moving from the hip joint, just let your thigh press toward the wall and release. And again, you may notice a big difference, or a little difference, or no difference between one side and the other. Good, and just finish up with one more. And then pause, slide the foot back up, uncross, and then notice. And then when you're ready to come out of the pose, you bend your knees, let the soles of your feet rest on the wall, and then you'll roll over to one side. And you may wish to just rest your head on your arm, take a few breaths here, allow the blood pressure to stabilize. And then when you feel ready, press your hand into the floor and come on up to a comfortable seated position. And again, just notice. And then when you feel ready, come on up to standing, have a little walk around, and just notice how your hips feel. Thank you. Namaste.